There are n number of organs, enzymes, hormones and peptides involved in the energy balance, and these are all the levels which get impacted with bariatric surgery. So if you look at this slide, you will know that it works on the GI tract, it works on the liver, it works on the adipose tissue, it works on the muscle cells, it works on the fat cells, it also works on the brain, and it regulates the complete mechanism which leads to obesity, and this is how it improves the obesity status of a patient towards a lesser obesity or non-obesity, and of course n number of comorbidities related to obesity get reversed. One of the fantastic outcomes of this operation, you can see here, is a resolution of diabetes. These are the different operations done for bariatric surgery. One is gastric band, the other one is gastric bypass, third one is gastric sleeve, and the fourth one is biliopancreatic resection. In which patient which operation should be performed depends upon multiple factors. It is the age of the patient, it is the expectation of weight loss, it is the expectation of life ahead, it is the existence of comorbidities and their severity, it is the nutritional challenges in the patient, it is the food culture of the patient, it is the behavioral pattern of the patient, and it is the lifestyle of the patient, medical risk of the patient. All these things are going to help an expert understand which operation is going to be the best operation for this particular patient. You can see the resolution of diabetes as against only the medical treatment in obese patients with type 2 diabetes is seen as a significantly different after bariatric surgery is done. It is significantly reduction of the hyperglycemia which is seen after these operations in the patients. These all operations are done laparoscopically, and these all operations have a long-term sustained effect. This is one of the world's famous studies, which is SOS study. This slide, if you can see, is formed in 2007, wherein it takes into account a 15-year data of these patients. Now they have published up to 35 years of data of bariatric patients who have undergone this surgery for various reasons like obesity and the related comorbidities. All these operations show minimum of 50% resolution of the disease up to maximum of 80% resolution of the disease. You can see here the different pathways how it works. Incretins are the various hormones which are secreted by different levels of the gut, and more important in these are proven to be GLP and GIP-1. These lead to the insulin sensitivity of an individual, and after these operations typically these levels change because the intestinal motility becomes faster. Finally, what it leads to is the nutrients reach the L cells of the ileum pretty earlier and induce the L cells or stimulate the L cells for the secretion of GLP-1. This GLP-1 has got a very strong insulin sensitivity action, beta cell sensitivity. It also improves the beta cells secretory capacity. The other mechanisms through which these operations work are multiple adipose cytokines. The TNF alpha, the interleukin 6, the C-reactive protein, all these levels start coming down after these operations, and the inflammatory status of the body comes down to a normality once bariatric surgery is done. This is a slide which shows how the various gut hormones impact the appetite. Initially, hunger was defined as a function of hypothalamus, but now it is defined by science as a gut-brain axis. So the primary signaling comes from the GI tract, and it gives various signals to the brain, typically the hypothalamus, which is going to set in the signals for appetite and hunger. These are the various hormones released from the gut which have got impact on the arcuate nucleus of the hypothalamus, and you can see here ghrelin is one of the hormones which increases the hunger to a large extent, and GLP-1, PYY, CCK, leptin are the ones which are going to give a negative signal for the hunger in the hypothalamus. All these things get affected by the bariatric surgery, leading to regulation of the hunger and appetite by the hypothalamus come normal. This is the slide which is showing the different operations which work against obesity as one of the very big scientific tools. This is a famous operation of gastric sleeve resection, where a part of the gastric greater curvature along with fundus is removed, and this leads to a lot of ghrelin production area. This also has got an effect on the GLP-1 secretion. The gastric emptying improves, and along with that the decreased ghrelin leads to a less starvation signal, a less storage signal towards the brain, and the patients, it becomes easy for them to shed off the weight. This is the gold standard operation of Roux-en-Y gastric bypass. You can see here. We will see the videos of these operations after some time, but this has got again many mechanisms which touch base towards the various levels of impact of bariatric surgery towards the multiple organs involved in the obesity regulation. These are the ghrelin, these are the GLP-1, these are the GIP and PYY. This is one of my studies which is published in International Journal of SORD, that was in 2010, and you can see this study talks about the impact of bariatric surgery on the cardiovascular health of an individual after the operation. There is a significant reduction in the stroke rate, in the fatal stroke rate, in the cardiovascular heart disease and the fatal CHD. This is something which we aim at when we treat any of our metabolic syndrome patients. Exactly how does it occur? Multiple mechanisms. We will just try to go through them. There are changes in the gut hormones which happen. One of the major players in this operation is ghrelin. Ghrelin by now is known as the hunger hormone, which is secreted by the cells of the greater curvature and the fundus of the stomach. Look at this slide very carefully. The middle graph shows a normal weight patient who is showing 3 times the up in the ghrelin levels and fall after we eat the food. This is the physiological behavior of any body, and these are the ghrelin graphs which are taken over 24 hours in an individual. When a person is subjected, when an obese person is subjected for medical treatments of weight loss through low calorie diets or very low calorie diets, what we are able to see is, you can see here, this is the level of ghrelin which has gone high from the baseline. It is showing a high amplitude and high frequency. After typically 3 weeks of these treatments, we are able to see a large amount of high level of ghrelin which body is suffering from. No wonder after 3 weeks typically patient is unable to control the hunger and patient starts blaming themselves. This has led to a lot of starvation signal and in turn the storage signal to the body, which the patient is unable to resist. In contrast to this, you can see this that after the bariatric surgery, the ghrelin levels have fallen down, they have become stable, the amplitude is now within control, the frequency of the ghrelin variations has come down, and the body is able to experience a very good amount of stable environment as far as craving, starvation, storage and satiety is concerned. There is enough data to tell us about the outcomes of these operations and how it modifies one's hunger, how it makes it normal or how it makes it adequate. Many times people have a fear that we may not be able to eat after these operations, but it is not right. Patients are able to eat adequately, keeping their satiety centers fulfilled and without having huge cravings towards the food. The part of hunger which belongs to your GI tract gets very nicely modified in terms of physiology of the hunger, and the patients experience a very big freedom from the cravings of the food. Of course, they do not lose the taste. The taste gets modified towards less processed food, less caloric food, but they are able to enjoy all types of foods. Ghrelin does work through multiple mechanisms. It is one of the master players in terms of obesity and diabetes, and finally it has got an impact on the glucose homeostasis. That is one solid reason why these operations work as anti-diabetic operations. There is one lower intestinal hypothesis which works through the increased motility and the fast stimulation of the ileal L cells. This is also called as ileal brake theory. What we are able to see is n number of hormones start playing their role after these operations are done. You can see in this slide the GLP-1, which has got a fantastic outcome, fantastic impact on the diabetic status of any individual because it improves the sensitivity of insulin, gets physiologically activated and stimulated after these operations. Multiple GLP-1 analogs have been tried for the treatment of obesity and diabetes, but nobody could fulfill the criteria of satisfaction because sometimes it was not controlled well, sometimes it was over controlled. These operations remove the hindrance in the insulin action and through the GLP-1, and how they do it, it is really it is really interesting and worth seeing. You can see that these are the operations. They rapidly reverse diabetes because of a strong insulin sensitizer action of GLP-1. These actions have sustained themselves even after 20 years. The most important thing after this operation is the GLP-1 comes from their physiological site of production. It comes in the right dose, sensitized by the amount of calories which you have eaten. So body is a very smart organ and it can deal with the diseases once we remove the hindrances and stimulate the right pathways. This is how these operations work as far as the combination of diabetes and obesity is concerned. These are the global guidelines. As we saw that in Indian patients, we are victims at an earlier BMI because of high fat percentage in our body. In specialized situations like in Indians, the BMI which is eligible to undergo operation when the obesity is 37.5. So when there is obesity alone without any comorbidities with 37.5 BMI is the eligible candidate to undergo bariatric surgery. In a patient who is more than 32.5 BMI with any of the comorbidities related to obesity, are the right patients to undergo these treatments, because timely actions, timely interventions are going to save their health related quality of life, the life expectancy, the complications, and the expenses on the medical treatments. IDF, the International Diabetic Federation, because of a large amount of metabolic action of these operations in terms of diabetes, have given the indication of BMI more than 30 with type 2 diabetes uncontrolled with standard medical care are the patients who should undergo bariatric surgery to save the remaining beta cell mass. So finally, let us try to know what are the different diseases that show resolution after the bariatric surgery is offered to obese individuals with these many health conditions. You can look at this slide and we know that it is migraine, it is depression, pseudotumor cerebri, where the intracranial pressure rises to the extent that patient can have intermittent blindness, obstructive sleep apnea, which can be a fatal disease, dyslipidemia, asthma. Asthma in obese patients is not the bronchial asthma, but it is weight related asthma. Non-alcoholic fatty liver diseases, cardiovascular diseases. So patients who are suffering from IHD with metabolic syndrome and obesity, even after angioplasties have been done in these patients, are the candidates who should undergo bariatric surgery, which can save them from further aggravation of the disease. Hypertension, yes, because when the abdominal pressure goes down, the renin-angiotensin mechanisms show modifications, and of course a pressure on the vessels will also show a lot of modification, which leads to an improvement in the hypertensive status of a patient. Gastroesophageal reflux disease is one of the very common diseases which is seen in obese individuals because of the high intra-abdominal pressure, which leads to the valvular dysfunction. These are the operations, because they reduce the intra-abdominal pressure, lead to a huge improvement in GERD status of a patient. You can also see here the metabolic syndrome, which comes with visceral obesity or central obesity, the type 2 diabetes mellitus, the polycystic ovarian syndrome, the stress incontinence, the degenerative joint diseases of a patient, and the vascular venous stasis disease, along with the multiple joint destructions, are the various diseases which show a huge clinical improvement, significant improvement after bariatric surgery with obesity. Thank you very much. We'll go ahead with few videos which are animated videos which can show us exactly how these operations are performed. So this is the operation of adjustable gastric band insertion done laparoscopically. You can see here we use different ports to insert the trocars and our instruments inside the abdominal cavity. Here we are going to place a bangle-like band which is made up of silicone, which goes around the upper part of the stomach. This band is going to be applied over near the fundus of the stomach, and it will convert the fundus into two pouches, upper small pouch and lower big pouch. After this band, when the patient, there is a small tube which acts as a connector towards the reservoir. This reservoir is placed beneath the skin in the subcutaneous pad of fat with a small device. Now after the band insertion, the pouch is going to hold the food for some time and keep the satiety for a longer time. After this operation is done, patients experience a better satiety with a small intake of food. Once they lose a certain kind of weight, certain amount of weight, the band tends to become loose and we need to tighten it. This reservoir placed subcutaneously is used to tighten the band. We fill it with saline up to a certain extent. This process needs to be gradual. There are many patients who may not need this tightening at all. This is going to enhance the hourglass action of the band, and this helps the patients lose weight in a significant way. In the band operation, we tend to lose almost 20 to 25% of excess weight in the period of an year. This is the operation of laparoscopic gastric sleeve resection, again done laparoscopically with the ports, and you can see a major part of the gastric curvature and the fundus of the stomach, which is an important thing as far as the ghrelin secretion is concerned, is removed in this operation. This removal leads to the fall in the ghrelin levels and the unstable ghrelin ups and downs which obese patients suffer from. Once this is removed, the ghrelin comes to a stable level over the 24 hours, and what we are going to experience is a very good satiety with less amount of food, a very good energy once the patient starts losing weight, because mind well, excess weight comes as a burden and not strength to the body. This operation also leads to nearly 50 to 70% of excess weight loss within a period of 1 year. Of course, after any operations, we are supposed to avoid the high calorie foods, and we will go ahead with the nutritionally oriented food pattern. This is the third operation. You can see this is the gastric bypass operation, done laparoscopically again. After laparoscopic operation, patient is able to go home within 2 to 3 days and can revert back to all activities within 3 to 4 days ahead. In this operation, we have formed a small gastric pouch. At a certain level from the DJ flexure, we bypass the first few inches of jejunum, duodenum and a large part of stomach, and the distal part of jejunum is connected to the upper small pouch of the stomach, making it the food pipe. Downstairs, the proximal part of jejunum is connected distally. So there are two pipes now, two pathways. One is the food pipe and the other one is digestive juices and enzymes where they mix with it. This leads to bypassing a major portion which is related to the insulin resistance and the fat absorption of the body. Thank you very much.
These interviews and events are featured by Docplexus exclusively for the doctors of Docplexus community. To receive updates regarding such upcoming events, please subscribe and like our YouTube channel, like our Facebook page, and follow us on Twitter. Happy Docplexing!